Welcome to section 5, that is anti-muscarinic agents or anti-muscarinic drugs. So the specific learning objectives are: you should know to classify anti-muscarinic drugs, explain the pharmacological actions of atropine, explain the therapeutic uses of anti-muscarinic agents with specific drugs used, enumerate the adverse effects, contraindications, and drug interactions of anti-muscarinic agents, and explain the treatment of atropine poisoning. So Anticholinergic drugs. So anticholinergic drugs are drugs which can block the cholinergic receptors. So as you already know, the cholinergic receptors are of two types. We have muscarinic receptors and nicotinic receptors. So drugs which block the muscarinic receptors are called as anti-muscarinic drugs, and drugs which block the nicotinic receptors are called as anti-nicotinic drugs. So nicotinic receptors, if you remember, are of two subtypes. You have NN and NM. So NN is mainly found on the autonomic ganglia, and drugs which block the NN receptor are called as ganglionic blockers. And NM receptor is mainly present on the neuromuscular junction, and drugs which block those receptors are called as neuromuscular blockers. They are skeletal muscle relaxants and they will be dealt elsewhere. So today, here we are going to focus on the anti-muscarinic agents. So anti-muscarinic drugs or atropine-like drugs or parasympatholytics or muscarinic antagonists they are called. Okay, so if you call anticholinergic drugs as anti-muscarinic drugs, it will not be accurate because anti-muscarinic drugs only block the muscarinic receptors. So coming to the mechanism of action, uh, as I told you, anti-muscarinic agents, they block the effect of acetylcholine, both central and peripheral effects of acetylcholine through the muscarinic receptors. So they cause reversible blockade of muscarinic receptors and thereby inhibit the muscarinic effects of acetylcholine, which is produced through the action on the muscarinic receptors. So they block all the muscarinic receptors. So you might remember muscarinic receptors are of 5 types: M1, M2, M3, M4 and M5. So they are non-selective antagonists. They block all the receptors. That's why they are non-selective antagonists. And this antagonism is of competitive type. So atropine competes with acetylcholine for the binding site at the muscarinic receptors. So this blockade can be overcome by a large dose of the agonist, which is acetylcholine. So if you remember the cholinergic neurotransmission, you have acetylcholine, which is synthesized, stored, and released into the synaptic cleft. Once it is released, it can go and bind to the receptors on the postsynaptic receptors on the effector organs and produce the action. So atropine inhibits the muscarinic receptors on the effector organs competitively and surmountably. In the sense, if you increase the dose of an agonist, the competition or the antagonism can be reversed. Now coming to the classification of anti-muscarinic agents or atropinic agents, we have natural alkaloids like atropine, hyoscine. We have semisynthetic derivatives. We have synthetic derivatives according to the action which is classified. We have anti-secretory or antispasmodics, mydriatics, vesicoselective, and drugs for Parkinsonism. So once again, we have natural alkaloids. We have atropine and hyoscine. Hyoscine is otherwise called as scopolamine. We have semisynthetic derivatives, homatropine, hyoscine butyl bromide, iprapropium bromide, tiotropium bromide. Then you have synthetic compounds. You have mydriatics, cyclopentolate, tropicamide. You have antisecretory or antispasmodic agents, glycopyrrolate, dicyclomine, pyranzepine, oxyphenonium, and clidinium. Then you have vesicoselective oxybutynin, flavoxate, and tolterodine. Then you have anti-Parkinsonian drugs. You have benzexol, procyclidine, and bifidine. Among these drugs, the natural alkaloids are atropine and hyoscine, otherwise called as scopolamine. Atropine is a prototype drug which is highly selective for muscarinic receptors, but some of the synthetic derivatives or substitutes we saw, they have significant nicotinic blocking property. Now, atropine is obtained from the plant Atropa belladonna and Datura stramonium. This is Atropa belladonna and Datura stramonium. Atropa belladonna. This belladonna means beautiful lady. Okay, so it has historical importance, atropine, because long time back, ladies used to apply the extract of these plant products into the eye, and these plant products produces dilatation of the pupil. It produces mydriasis. So as to the eye appears bigger and seductive, they used to apply atropine. That is why Atropa belladonna, the name was coined. So you have Datura stramonium also, from which the plant can be extracted. So coming to the chemistry, so atropine is a tertiary amine alkaloid ester of aromatic acid, tropic acid. So you have tropic acid combined with a base which is tropine, which gives you atropine. And for hyoscine, you have tropic acid which combines with the base copine. That is the hyoscine structure. So that's all about the introduction. The pharmacological actions will be dealt in the next video. Thank you.